Welcome to Communities for Recovery's Naloxone Distribution Hub training. Today you'll learn how this vital program empowers communities to save lives and fight back against the devastating opioid epidemic. As part of our ongoing harm reduction efforts, the Naloxone Distribution Hub at Communities for Recovery stands as a frontline defense in the fight against opioid-related overdoses. Today, opioid overdose is the leading cause of preventable death in the United States. Through public education, overdose response training, and free naloxone distribution, we're reducing these tragic preventable losses and giving individuals a second chance.
To understand where we are today, we need to understand how we got here. The opioid epidemic has evolved over 4 distinct waves. The first wave began in the 1990s, when prescription opioids were aggressively marketed and widely prescribed, often with little oversight. The result? A surge in dependence, misuse, and diversion of painkillers like oxycodone and hydrocodone. When regulations tightened, many turned to a cheaper and more accessible alternative, heroin. This shift brought a spike in overdose deaths and a second wave of crisis. The third wave was driven by the rise of illicit synthetic opioids like fentanyl. These substances are often mixed into other street drugs, and even tiny amounts can be deadly. Polysubstance use has long been a major factor in overdose deaths. Most cases involve a combination of substances, like opioids mixed with alcohol, benzodiazepines, or other prescription medications such as gabapentin. Using multiple drugs together significantly increases the risk of an overdose. There have been over 1 million overdose deaths in the U.S. since 1999. Roughly 7,000 Texans die from overdose each year. To put it into context, we will still lose more Americans to drug overdose this year than we did soldiers in the entire Vietnam War. Opioids include both natural opiates derived from the poppy plant, like heroin and opium, and synthetic opioids such as fentanyl and prescription drugs like Vicodin. An overdose occurs when these substances slow breathing to dangerously low levels. Always remember, oxygen is the true antidote. If naloxone isn't available, your priority should be helping the person breathe. Common signs of an opioid overdose include unresponsiveness, slow or stopped breathing, gasping or gurgling, pinpoint pupils, and cold blue or gray skin. If untreated, an overdose can lead to brain damage or death due to the lack of oxygen. Lack of oxygen is the cause of death.
Naloxone is a life-saving medication that can reverse an opioid overdose. It works by blocking opioid receptors in the brain, which helps restore normal breathing. However, if someone has also used other substances like alcohol or benzodiazepines, naloxone won't reverse the effects of those drugs. It only works on opioids. Naloxone stays active in the body for about 30 to 90 minutes, but many opioids last much longer. That means more than 1 dose of naloxone may be needed. Even fentanyl, which is one of the shortest acting opioids, has a half-life of around 2 hours, much longer than naloxone. So after the naloxone wears off, the opioids could still be active and cause breathing to slow down again. This is an example of why multiple doses of naloxone may be required to prevent further harm. Check for overdose signs. Is a person unresponsive? Are they breathing slowly or not at all? Are their lips or nails blue or gray? Call 911 immediately, even if they wake up. Medical help is still essential. Try to wake them up. Shout their name. Shake them gently. Perform a sternum rub by firmly rubbing your knuckles on the chest bone.
Naloxone is available in multiple forms: IM or intramuscular, either in a vial with a syringe or as an auto-injector that talks you through the steps. Intranasal is available by a few brand names. That's the one we'll focus on today. Peel open the package, hold with your thumb on the plunger and 2 fingers on the nozzle. Insert into one nostril until your fingers touch the nose. Press the plunger firmly to spray the full dose. 1 push, 1 dose. You do not need to prime the device. It comes ready to use. Administer rescue breaths if you are comfortable, and remember that it's the oxygen that keeps someone alive. If you need more help, be clear and direct. Point to someone and say exactly what you need. Turn the person onto their side in the recovery position. If they're not breathing, tilt their head back, pinch the nose closed, and give 1 breath every 5 seconds. Continue until they breathe on their own or until help arrives. If there's no response, such as a return to normal breathing or consciousness within 3 minutes, give another dose. Stay with them until EMS arrives. Be ready for possible withdrawal symptoms like nausea, sweating, or agitation.
You don't need to be a doctor to save a life. Just by understanding the opioid crisis and learning how to use naloxone, you're becoming a powerful part of the solution. But it's not just about knowing how to use it, it's about carrying it with you so it's there when someone needs it. And remember, oxygen is the true antidote. If you don't have naloxone on hand, rescue breathing can still save a life. Join us at Communities for Recovery. Together we can make sure every life counts.